Hi, everyone. Fran here. I am so excited. I have a guest coming on Hopenning 2.0 that you may know already, Dr. Ran Anbar. He just came out with a new book. His previous book is all about how to use hypnosis with children. And the second book is The Teen's Guide of Living a Good Life. There's lots of surprises on it for me and for you. God bless. Hello, everyone, and welcome to the Hopenning. This is the place where hope is happening if you open your minds and hearts. And today, my special guest is Dr. Ron Anbar, and he comes to us from La Jolla, California. So welcome, Dr. Anbar. It's a pleasure to have you here.
Thank you. Greetings from California.
I am in not so sunny northern Alberta. We just had a dump of snow this morning. So California, I know, is being a little bit different right now.
Yes, we're a little warm here, although fires fortunately haven't reached too much into the San Diego area where I live.
Yes, thank God. Thank God. So Dr. Ranbar comes to us with a wealth of information and a wealth of certifications, and I'm just humbled and grateful. He's a board certified physician in general pediatrics and pediatric pulmonology. He served as professor of pediatrics and medicine and as a director of pediatric pulmonary at SUNY Upstate Medical University in Syracuse, New York. He has trained more than 1,000 healthcare providers. He had his first groundbreaking book, Changing Children's Lives with Hypnosis, A Journey to the Center, which was released actually during the pandemic in 2021. He's written over 270 articles, abstracts, and book chapters on pediatric care and offers counseling and hypnosis at Centerpoint Medicine in La Jolla, California, and in Syracuse, New York. And so over the years, over 8,000 children have been helped by Dr. Anbar. I am just so honored. It's such a privilege to have you here today, Ron.
It's a privilege to be talking to you.
Thank you. And we discussed before we came on that I'm his first book tour person. I get the interview first because you've got a brand new book that it hasn't been released on yet.
Right. It will be released on March 4th. It's called The Life Guide for Teens, and it's available for pre-order at this time.
Yes. And I have a copy. I read my copy already, and it's delightful. Ron, as you know, I've spent a career teaching children. I've taught children all the way from grade 1 to grade 6 and older ones as well, not full-time, but I spent 34 years in the classroom. And when I read your book, Ron, I was like, yes, this is what needs to be in the hands of parents and teenagers, and even middle school children can read your book and get a wealth of just insights and tips and tricks and knowledge from someone who's been in the field. And 8,000 children, how is that even possible?
Well, I work many hours a week. I work 6 days a week from 7 in the morning till 7 at night. But it's not even work. It's enjoyable. I help people, and there's nothing better to do, in my opinion.
Absolutely. Oh, I know. So let's talk a little bit about your book, Ron. Why did you write it?
Well, my mission is to get the word out to people how they can help themselves. And I can do that individually, one-on-one. And it's very rewarding to see a child unfold from being wrapped up into themselves to blossoming like a flower and ready to help the world. But I can only 8,000 children is a lot of children, but there's a whole lot more out there. So I wrote the book in the hopes that some of my knowledge can help others who will read it. It's written in there's different chapters about things that affect teenagers, like anxiety, or sleep issues or relationship issues or sports, stuff like that. And every chapter has several tools that the teens can use to deal with that particular issue. And in fact, the good thing about the book, you don't have to read the whole book. You don't even have to read the whole chapter. If you pick up one tool and start using it, and I understand you did that already, then it's worth the book, worth the read.
I did use one of your tools already as I'm speed reading your book in order to be able to talk intelligently to you today. I used one of your tools, and we'll get into that later. And there's also what I appreciated as well within the book are actual testimonies. I would call them testimonies from teenagers that you have worked with, and they gave snippets of little advice to another teen, another child maybe, who may be reading the book at that time.
Correct. And what was fun about writing this book is I had my intended audience in my office every day. So the book, as I was writing the chapters, was read by 10, 15 teenagers and got feedback from them. And in fact, 50 or more of them are acknowledged in the acknowledgement section, the very front of the book, because they helped contribute to reviewing the book and gave me some of the excerpts that I used from them.
Yeah.
So it's been audience tested already.
Some of the tips and techniques that you taught them help them overcome incredible situations. So, Dr. Anbar, how did you go from being a trained physician in pediatrics and pediatric pulmonary to using, and your book is behind you there, and I've got a copy of your book right here.
Yay, double.
Yeah, yes. How did you go from being a medical doctor and, like people of our generation, we were trained scientifically. This is how the body works. This is what we do to treat that certain part of the body, whether it's the lungs or whether it's the heart or skin or the mind or whatever. So how did you go from that type of thinking, because it's really a mindset, to this shift? I believe it's like this huge shift of not only the physical body, but it's using hypnosis, but also concentrating on the whole person, spirituality, emotion, altruism. Where did that come from?
Well, I'm going to give you a spiritual answer in that I was guided here. I met a young man 27 years ago already who had a very bad food allergy to milk and very bad asthma. And twice in his life, he almost died from eating milk product. And he said to me, lately, when I've been smelling cheeseburgers, I've been developing asthma attacks, which I thought was a kind of a strange symptom. And I asked him, can you imagine eating a cheeseburger? Which is something he could not do in real life. And so he closed his eyes, and within seconds, he was having a lot of trouble breathing. So much so I thought he was going to have a terrible asthma attack. And I said, stop it. And he did. And I said, you're kidding me. No, no. He said, I couldn't breathe. So immediately my mind is going, wait a minute, you thought yourself into a physical problem? And if you can do that, can you think your way out of a physical problem? And that's how I got involved in the world of hypnosis and the imagination. So I worked with him for a good year. He didn't want to go see a psychologist because he said he wasn't crazy. But under supervision of a psychiatrist at Upstate Medical University, I worked with this young man for a good year. And I read a lot about hypnosis, which is a nice way of thinking about that, is using your imagination to help yourself. And I learned with this first patient, whose name was Paul, that not only can his mind control his physical body, but the mind has a lot of dimensions to it. Very quickly, I learned about the subconscious, the inner self. And what I read about in the literature was you can ask the subconscious to move fingers to indicate yes, no, or I don't know, and you can ask yes or no questions. I did that for about 5 minutes and got frustrated with asking yes or no questions. So then I asked, will you talk to me? And the subconscious said yes. So the next time I met with Paul, we sat down and I was going to talk to his subconscious. And I prepared a list of bunch of existential questions. Like imagine you can talk to the subconscious, which by the way you can. But at the time I never thought of it possible. So I asked all the tough questions I can think of, like, what is love? What is music? Have you seen God? What is heaven? Can you talk to spirits? How do you affect the body? All these crazy questions. But he had answers to all of them. And this is what opened my mind up to, there's a resource inside of us that can have answers to those questions. And if you do ask existential questions, you get existential answers. You can also ask simpler questions, like I talk about in the book. Can I trust this friend? And what's the answer to my test? Can you give me an idea that I can use in a creative way? There's all sorts of questions you can ask. In the New Testament, there's a quote, ask and you shall receive, I believe it is.
Yes.
And it's that kind of idea. If you ask your subconscious, your inner self questions, you're going to get answers. And a lot of the life guide for teens talks about tapping into this inner resource.
Yeah. And you talk about that actually throughout the book, just about in every chapter. So I wanted to talk, if you see me looking down, Dr. Anbar, it's because I'm looking at my notes, because I want you to know that this is so important to me. So you started out with the visualizing, actually teaching a reader of your book how to, basically, I call it self-hypnosis, right? So can you go through the steps that you would teach a child, a teenager in your office, how to self-hypnotize themselves so they can tap into their subconscious anytime they want to?
Sure. So before we give you the answer, I want to clarify it does not involve mind control, does not involve sleep. It's not unusual. We all do hypnosis all the time. When you drive in the highway and say, how did I get here? Part of you has been driving and part of you has been thinking about what you can do next, and that's hypnosis. When you've been in a boring lecture and start daydreaming, that's hypnosis. But hypnosis is such a controversial word. I made sure I left it off the cover of the Life Guide for Teens because I think this word, big word in my first book, might have inhibited its sales to some degree because some people are scared of it.
Okay.
So I'll let you know in a couple of years if that was correct. Anyway, so the way I teach kids to calm themselves with hypnosis is I suggest they pick a place that is safe and comfortable for them. They'd like to imagine going to. It could be a place they've been to, a place they want to go, even an imaginary place. And once they have the place, we talk about what they can imagine with each of their senses, what they can see, hear, smell, feel, and taste. And we'll actually talk about it as they're doing this experience. And the reason we focus on the different senses is it activates different parts of the mind. Functional MRI studies show that when you imagine a sense, the same part of the brain gets increased blood flow as if you're really experiencing it. So to the brain, it's sort of the same. And so by revivifying the imagery, the person becomes calm. And then I'll talk to them about relaxing themselves from head to toe. We'll walk down from the forehead to the eyes, to the cheeks, to the jaw, all the way down to their toes. And then a very important part, I teach them to pick a sign, a gesture that will trigger their relaxation response, even when not doing hypnosis. By a sign, I mean a gesture like thumbs up, A-OK, crossing fingers, they get to pick. And then they rehearse that while in hypnosis and tell themselves, whenever I make this sign, I can become this relaxed, even when I'm not doing hypnosis. And then I tell them you can stay in that state as long as you want, a minute, an hour, a year. Time has no meaning. It's like a dream you're in charge of. And then when you're ready to come back, you're going to tell yourself 4 things. First, you congratulate yourself for your great imagination. Second, you remind yourself to practice this every day for at least 2 weeks. This is a mind-body skill. The more you practice it, the better you become at it. Third, remind yourself whenever you want to calm yourself without doing hypnosis to make your relaxation sign. And lastly, you could tell yourself good things. And the more you tell yourself good things, the more likely they are to happen. Such as, I'm feeling better right now. I want to keep feeling this way. I want to do well in school tomorrow. I want to do well in my athletic competition. And then when you're ready, come back. And then when they come back, they'll typically say, oh, I feel more relaxed. Typically, this was pretty real or very real in my imagination. And then I'll have them do it again on their own. And I'll say, when you finish, tell me, does it feel the same or better? Notice I don't give them a choice of worse. This is called forced choice. Same or better. And generally they'll say better. Sometimes they say the same. Whatever they say, I say, great. You don't need me to do this. You could do this on your own. And that's really important in how I teach hypnosis. I want the young person to know it's their tool. It's not something I did to them, because I want them to take it independently. And then kids will come back and say, I've used the hypnosis. I made my headache go away. I calmed myself during a test. I got in an argument and I was able to stay calm. And you can see the fruits right away in many cases.
I want to show a clip, Dr. Anbar, because the last time I interviewed you was a little over 2 years ago when I was going to have surgery. I was going to the next day, I was interviewing you from the hotel room, which was less than a mile away from the hospital where I was going to get surgery. I was a little worried because it was surgery on an aneurysm. It's like the mind tends to go to the worst possible scenario. And so I asked you for some tips and tricks, and I'd like to show that clip right now with your permission.
Of course.
Awesome. I'll share my screen and the sound. All right, so here it is.
I wish you much success.
Thank
Playing
you.
fine.
Thank you. That's why I'm in the hotel room, right? I'm not in my own home.
My wife underwent open heart surgery earlier this year. So you know some of the path. First of all, you can do a lot of visualization regarding healing. So you can imagine little doctors or little armies or little nurses going through your heart and healing, and to your chest healing. You can imagine healing quickly, faster than because the doctor will tell you, oh, it's going to be 2 months, 1 month. Don't listen to that. You can go on your own pace, and you can surprise everyone by how rapidly you recover. In terms of discomfort control, you can learn how to. I'm sure, Marina, you know how to teach their comfort. I don't use pain control. Comfort and discomfort.
Like that.
When you take discomfort, take away the dis, you get comfort. So there's many different comfort control measures you can take, anywhere from changing the color of the discomfort to a more comfortable color, to spreading a part of the body that feels good, to spread that goodness to the part that needs healing, to imagining a control panel in your brain that controls the level of comfort you have, to taking the discomfort from the chest to the little finger wicks more tolerable. There's all sorts of ways of dealing with discomfort. Also seeing yourself fully recovered and how great that will feel. And so those are some future projection techniques can very helpful.
All right. So that's what I did, Dr. Anbar. The thing about the surgery, it was supposed to take about 2 hours to repair the aneurysm. And so I was ready. I could see, when you're having that type of surgery, you're awake. And I could see on the screen in front of me what was going on, what the surgeon was doing. He had a screen over here. There were people doing instruments, and there were people in the back room figuring stuff out. And I didn't know what he was sticking inside my aneurysm in order to block it, because it was at a size that could have burst at any time, right? So he was packing it full of material in order so that the blood would flow somewhere else. That aneurysm made that artery no longer safe. And so I could watch it. And I used her techniques. I just kept on sending these messages to my brain about the little, you talked about the little control panel. So I imagined these little people inside my brain, and they were directing where the instrument went through into my aneurysm and pushed this material in it. These little people in my brain were directing it. And so every time the instrument went in, I could see it on the screen, and my brain, little people inside my brain were like a little bit closer, a little further back, push it in tighter. That's good, right? So all these little people are directing traffic about what's supposed to happen. And then when the surgeon I could hear the surgeon talking. He's like, "Oh, this is good. This is very good. This looks really good." He wasn't talking to me. He was talking to himself or talking to the people with the nurses helping with the instruments, the technicians in there. And then he said, "That's about it." And I looked at the screen, and it was like barely 45 minutes. And I'm like, because I could speak, "You're done?" "Yep, that'll do it. I'm very happy with this." And then he showed me what he put in. There were 7, we call it meters in Canada. There were about 7 meters of this fine, I think it was platinum, I think it was platinum, very fine thread that he was filling my aneurysm full of. So when I get back to my room upstairs, I had to lay very still. I couldn't move my head. I couldn't move my body at all for 5 hours. And for me, that's just about unheard of, like unheard of. So I kept on imagining these little people in my brain directing traffic, saying, "No, you're doing great, Fran. You're doing great. How are you feeling, Fran?" And I'm like, "Oh, I could use a little bit more comfort control." And so we're on that. And they would move these sliders, the sliders for the comfort control from a 0 to 10. They would be like, it's only on a 3 right now, Fran. We will move your comfort control up to a 5. And they slid that little comfort control up. And I would say, "Yeah, that's perfect. I'm good now." And same as the control of my body. "How are you doing now, Fran? Or do you feel, how is your comfort control for moving your body?" And I'm like, "Yeah, I could use a little more right there in the small of my back." "Okay, we're sending comfort control to you." So, I mean, the techniques that you taught me in that brief little, I think it was 4 minutes, it helped me control my comfort and my healing. And that was over 2.5 years ago. And every CT scan that I've had since, it's perfect. My CT scans are perfect because we worried what would be the result of this changed artery, what would happen to my blood flow. And according to my surgeon, I won't have to have another CT scan now for 2 years. So thank you for that.
Well, this is a wonderful testimonial. Do you believe that your little repair people hastened the conclusion of the surgery? Do you think it went faster because how you were thinking?
Absolutely. Because they were actually inside. My little control people were, you talk about it in the book of how the head and the gut are related. Well, my little control people were controlling their little servants inside my aneurysm and inside my artery to be like directing traffic in there.
Power, I mean, what a powerful testimonial. But the power you had, here you are, you're having surgery. If you didn't know what we talked about, you would just lay there and let something happen to you. But you're actively participating in everything, which I assume made you feel a lot more in control and better about what you did.
Absolutely. And it was like my little experiment too, right? Because I'm a curious person and I want to see if experiments work. So Dr. Anbar told me that this would work. I'm going to check it out.
And so a couple more, I mean, there's so much to learn from your experience. So um, you shows the power we have inside each of us. Okay? Everyone has this power, but you have to tap into it. And some of the elements of why it worked for you, the first is you believed it could work. So if you say, no way this could work, it wouldn't work because it's your belief. So it's really important that you're open-minded. Second thing, I think is worth saying, and I think just for everybody listening, an aneurysm repair, I guess your skull is open and they're in there. I don't even.
It was here in my
Oh,
chest.
it's chest.
It
It's chest
was,
aneurysm. Okay.
it was in my chest.
I didn't know where the aneurysm was.
Yeah.
So we clarified that. And it's interesting you're awake through it. And then how do the little people work? Just so people understand the scientific basis for that. So that you don't really have little people in you, I don't think, but they're a metaphor for telling the body to repair itself. And we do have control in many ways over the body, in ways we don't really typically think. A very simple example would be if I cut and here, and you start bleeding from here, you can tell your brain, stop the bleeding from the right arm, and it will. We have that much control over our autonomic nervous system, the nervous system that typically is not in conscious control. And so when you imagine little people and comfort levels, levers and all, the body does what it can to follow your instruction. A simple example that I talk about in my first book is, if you want to check this out, especially if you're a smaller individual, is have somebody pick you up from behind, and then imagine that your feet are glued to the ground. You have big lead weights tied to your ankles, and have them pick you up again. And typically you'll be heavier, and they don't even know what you're thinking. Or you can do the reverse. You can imagine wearing a belt tied to a million balloons, like in the movie Up. So balloons carrying up in the air, and then you'll be lighter. So that's a simple example of how what you think about can affect your body. And you gave a very intricate example. And I want to invite you, Fran, to write a blog about this. I blog every week for psychologytoday.com. People are welcome to find my blogs. And maybe you and I can co-author a blog about your experience. I think could help a lot of people.
Oh, I would love to do that. I would love to. When I was imagining the sliders, the comfort levels, you talk about that in your book as well. So I think it would be helpful for our viewers, whether you're parents or whether you're grandparents or whether you're teenagers or whoever, to know about these sliders and the dials and the colors that you talk about in your book, because all are really interesting ways of managing something that's going on physically as well as emotionally in your body.
Correct. So a simple example is a dial. And the dial, I should tell you that this book is illustrated because it's for teenagers. And so we have an illustration of a dial. So if you imagine a dial, we'll call it a comfort dial, you can turn it, and in one way you become less comfortable, another way you become more comfortable. And so we don't use I don't call it a pain control dial because, as I mentioned a couple of years ago, if I say pain, you're going to think about pain. If I say comfort, you're going to think about comfort. So you're going to increase your comfort. It's sometimes useful to decrease your comfort just to see how it works, to make sure that it really does work. So some people want to do that. But the beautiful thing about the dial, you could do the same thing with a lever. You can have up can be worse and down can be better, or vice versa. It doesn't really matter what direction. But you can use these dial techniques for various things. So not just for comfort with pain. If you're very sensitive to loud noises, something called misophonia, you could decrease the volume. If you're very anxious, you can up and down regulate your anxiety. If you're very angry, you can up and down regulate your anger. So the dial metaphor is very useful. You mentioned colors. Colors can also be used for metaphor. So for example, if you have a discomfort, you can imagine a color that represents that discomfort, perhaps red. A lot of people pick red. And then ask yourself, what color will the area of my body be when the comfort is better? and it might say blue. And then I'll say, in your mind's eye, turn the red into blue slowly. And as you do that, notice how your comfort improves. So that's another comfort technique.
And in the book, you give some ideas about anger. And being a parent, you were a parent too. We both had teenage children who, on a dime, their emotions would change, right? They would be pleasant, and then there was some word or something that happened, and automatically they're angry, and then they would go from angry to crying, and the rest of that. You give some very helpful strategies, not only to teenagers but also to parents, about managing emotions. Can we talk a little bit about that too?
Sure. Well, first thing is, the idea would be to prevent the anger in the first place. So one of the things that I tell kids is that if you're aware that certain situations provoke your anger, like your parent tells you to take out the trash or stop playing the video game, you should be using your tools, and we'll talk about tools in a minute, before you get super angry. Because once you're super angry, it's often hard to even think straight. That's one thing. Second thing I want to say first off is that, well, second thing first off, is that if either the child or parent is angry, the other person should not really try to stop it or get angry in response. You know, if the child misbehaves and gets angry, the parent wants to correct them right away, but that falls on deaf ears. Once somebody's angry, they kind of shut down. And the reverse is true as well. I teach teenagers, if your parent is angry and you want to get a point across, that's not the time. So cool off, let them cool off, and then come back and talk. Now, specific tools, if you start getting angry, include using the relaxation sign that we talked about before, when they learn the imagery, right?
Yeah.
There's a tool called the stop tool.
Yes.
And that stop stands for stop, wait a moment. And then the T stands for think, or take 3 deep breaths. So there's 3 T's there. Think, take 3 deep breaths. That gives you a chance to slow down. And most teens, if they think, they're able to figure out a better solution than getting upset, or getting upset in an uncontrolled way. The O in stop stands for observe. And so you want to observe yourself as if you're a third person. What's going on here? It gives you a different perspective. Maybe you'll realize, for example, that what you're getting angry about is really a small thing. It's not worth this emotional outburst. In fact, with most kids, I tell them, well, I tell kids that most of the stuff they get angry about is really not that important. And they'll agree when they're calm. So observe and realize you can let this one go. And then the P in stop stands for proceed with positive intentions, positive thoughts. The positivity is something else I talk in the book about, the importance of speaking to yourself in a positive way. I can overcome this. I can feel calm, as opposed to saying, this is never going to get better, or I hate myself. Because what you tell yourself is sort of how you program yourself. So if you really don't like something about yourself, rather than telling yourself, I hate it, tell yourself, I want to get better at this. Same idea, but in a positive way. And then if you tell yourself you hate yourself, your brain says, yep, you hate yourself. If you tell your brain, I want to get better at this, the brain's thinking, how am I going to get it better? And then gets you there, just like your little people brought you comfort.
Well, exactly. Like, even by you saying, I want to get better at this, your subconscious or inner wisdom is going to get started on that. If they're going to get on the ball because you said you want it, right? So it's like, okay, so I think this is where creativity plays into this as well, because 3 major points that you talk about in this new book is spirituality, creativity, and altruism. So I think the subconscious mind, the inner wisdom, has an abundance of strategies. So all we need to do is ask, like you talked about, the power of asking and to ask our own subconscious. So your book, I felt, was different than the first one. The first one was more technical. I loved it because I'm so into this kind of stuff. But the second book, I think, is the perfect book for parents and teenagers, caregivers of any kind. I'm now teaching pre-teachers, so I'm no longer in the classroom. But the pre-teachers that I'm teaching them some of your techniques. And I just taught them yesterday the stop technique, because there will be students in their care that need to learn to self-regulate.
I love it. I think that's great. I think that another tool I would encourage all teachers to know about is the tool of positivity. And I told you before about how you can imagine being heavy or light. You can also imagine being strong or weak. And the demonstration that teachers can show their students, and actually I'm going into a third grade class next month to demonstrate this to 8-year-olds. But if they hold up their arm like this,
Right. Yes.
and
Yes.
then their job is to prevent somebody from pushing their arm down. And then if they say they're weak, they become weak. If they say they're strong, they become strong. And if they say, I'm not weak, they still become weak because the brain focuses on the weak word. And when you show this to the kids, they get it. And then that's when we talk about being positive, because what you say is what happens. And third graders understand this. And sixth graders understand this too.
Yeah. Oh, they definitely do. So let's talk a little bit about the last time we met. There was a boy in my fifth grade class who was bringing a stuffed animal to school, and he tended to be non-compliant. So if I was to say, you need to leave that in your locker, that would create an outburst in him. So I let him bring it into the classroom. But he spent so much time like throwing it up in the air and talking to it, and the kinds of off-task behaviors prevented him actually from getting his schoolwork done. And so you gave me some advice. And at that time I was having surgery, right? So I wasn't going to be in the classroom for a bit, but I let my substitute teacher know what to do. So I did. I told her about the advice that can you tell me again about the advice you gave me about the stuffed
Well,
animal?
I don't remember what I said, but I could tell you what I tell you now.
Okay.
I would tell you a couple of things. I would maybe I said the same thing. You'll tell me in a moment. First, I would say if he's bringing the stuffed animals, it's very important to him. It's his tool. It's his calming tool. So telling him to put it away would not work, which you found out the hard way. I remember my daughter when she was 4 years old needed to get shots every day for her medical condition, and I taught her how to handle it by blowing bubbles. She had soap bubbles, and then she would blow the bubbles and imagine fairies or unicorns in the bubbles while she was getting the shots. And she took the shots really well because she learned to focus her mind on the bubbles instead of the shot. This was a hypnotic technique for a 4-year-old. So then it was time for a 5-year-old shots, and she went to the pediatrician's office. She brought her soap bubbles with her, and the untrained nurse says, "You can't blow bubbles here. You could blow them later." And my daughter's saying, "No, no, this is how I do it." "No, you can't." So there's an example of a provider who doesn't understand the role. So what I would say now, I said this 2 years ago, I would say, so you want to use the stuffed animal. So I would talk to the stuffed animal and ask what the boy needed. I would ask the stuffed animal, do you think it's a good idea for the boy to settle down? And what could he do to settle down? And then I would follow that advice. And I think that's what did I say something like that or something different?
Yes, you actually said, as a teacher, talk to the stuffed animal and ask the stuffed animal how he could help the boy get his work done, right? And so I did this. I told the substitute teacher, And she said the next day he brought in 3 stuffed animals. And it was like, okay. So then you gave me some incredible wisdom. I don't know if you remember what you told me, but I will tell you what you told me. You told me that it was fine if he had 3 stuffed animals, but each of them needed to have a job. So if they were going to be there, they needed to have a job. So tell our viewers again how you would do that in a situation where you're allowing this child, or maybe the teenager, whoever it is, could even be an adult, right? Who needs something in order to feel safe. What role does this, whatever it is, this icon or the talisman or whatever it is, how would you deal with that?
Well, so again, the principle here is utilization. Use what the patient is giving you. And that same principle guides me when somebody says, I saw a ghost or a demon or an angel or a monster. You use it. You don't run away from it. You don't say, that's not real. You say, well, what does it mean? And what does it say? So with the stuffed animals, I would ask each stuffed animal, how would you like to help the boy? And then as best possible, sometimes I would negotiate with them. If stuffed animals, well, I let him run outside in the middle of class. I'd say, well, maybe do that at recess. But I find most situations like this, the character is willing to work with you and with the boy. And again, from a scientific standpoint or psychological standpoint, what's going on here, the stuffed animals represent different parts of this boy's ego, of how he conceives himself. And when you honor the stuffed animals, you're honoring the boy.
Mm-hmm.
And then everybody likes to be respected. And this is a boy who probably was not very respected by many people because of his behavior. And suddenly, when you're talking to the stuffed animals and giving them important jobs, he feels good about himself. And that's how this works.
Mm-hmm. Yeah. And it did work out, Ron. It did. Because I was off for a chunk of time healing. The He just lost interest, right? He lost interest in bringing them to class, and he didn't bring them anymore. So it was interesting how just acknowledging their role for him to hear that an adult was interested, paying attention, and helping him work with this in such a way that it empowered him. So the book talks a lot about empowerment. So can you talk a little bit about how parents, how teenagers, how children need to feel so empowered?
Great question. So empowerment, first of all, is really key to a successful life, right? If you're not empowered, you won't take on risk. You won't take on new activities. You won't believe in yourself. So to be successful, empowerment is key. And there are many ways that your child can empower themselves, and you as a parent can help empower them. So one important tip for parents is that you need to let your child make their own choices and suffer the consequences of their choices. So key. So like the typical helicopter parent who's overseeing everything that child does, just making sure they're doing just right, is hurting their child because they're not letting a child make their own choices. Doing things the hard way is an important way of learning. Ralph Nader, the consumer advocate, said that your best teacher is your last mistake. If parents prevent children from making mistakes, the children don't learn. The children don't learn because the parent tells them this is how you do things. The children learn by doing things and finding out what works and what doesn't work. And it's sometimes hard to sit as a parent if you're a concerned parent, especially if you're an anxious parent. You don't want to see anything bad happen, but you have to understand things that don't go well as part of the learning process. It's a good thing. I'll tell kids that come in the office and say, I'm so glad you broke your leg. Why? Well, now you have an opportunity to appreciate how good it is to have a healthy leg. And now you have opportunity to do things other than sports for the next 2 months, and you can discover new things about yourself. And now you have the opportunity to reconsider, do you really want to do that sport or whatever? So there's always, even when bad things happen, there's good aspects to them. And in fact, I heard a recent new term called bulldozer parent. Have you heard of that, bulldozer
Oh,
parent?
gosh, no, but I've seen them.
The bulldozer parent clears the path for the child before the child
Yes,
ever gets there. So there's no
yes,
obstacles at all. That really is hurtful to the child.
yes.
And those children, when they get to college, they fall apart because they don't know how to deal with the obstacles as naturally rise up. So empowerment is a process where the child learns to depend on themselves and believe in themselves. We talked about a couple examples already. You were empowered with a little doctor people, comfort people. The boy was empowered by an adult talking to his stuffed animals. A child could be empowered by playing in a sport and succeeding, or
Right.
learning how to deal better when the sport doesn't work out the way they want to. So all those are empowering things. Learning to talk to your inner self, your subconscious, and realize how much knowledge and wisdom is within you is also very empowering. I saw an 8-year-old boy who had an anger issue just this week, and he was explaining how he was able to think differently. So when his brother was picking on him, he told himself his brother loves him and doesn't know what he's doing because it was a younger brother, and he didn't get angry anymore. This 8-year-old explaining, this 8-year-old is now empowered because he realizes that anger is not automatic. He has control over whether to go there. I talk to kids about how you think is what you become. I mean, Buddha said this 2,700 years ago. What we think is what we become. That's nothing new, but the kids don't know this, so I teach them this.
Yeah. And I think that plays into one of the quotes from your book, where you talked about the one person out of 8 billion who can help you. So who's that? Who's that one person in your life, Dr. Anbar, who can help you? Because I want that person to.
Well, that person is yourself, so you have to find it. But you already found her. She's already helped you. Now that you know she's in there, she can help you always.
Yeah, it took me a long time to get it figured out. And thankfully, I did by lots of my own empowerment, right? You learn that really the only person that can help you is yourself. But I think that's a perfect way of talking about spirituality. So if the only person who can help me is myself, Dr. Anbar, why do I need to worry about a higher power? Like, don't the two contradict?
Great question. Well, that's actually the subject of my third book that I'm working on right now, which will be out in 3 or 4 years, God willing. But I would first start asking, what is yourself? What is self? Who are you?
Mm-hmm.
And if you go into I am my conscious mind, my subconscious mind, well, who is the subconscious mind? So in my experience, if you ask the subconscious mind, who are you? You get very interesting answers, which are very spiritual in nature. Who am I?
I'm going to ask myself tonight before I go to bed.
In the Bible, when Moses says to God, "Who are you?" Who shall I say? He says, "I am who I am,"
Yeah,
or "I will be who I will be," depending how you translate it.
right.
So when you ask subconscious, "Who are you?" Sometimes it'll say a guide for the conscious self. Sometimes they'll say, "I'm the soul." Sometimes they'll say, "I'm God." You get various iterations of that kind of thinking. And then you can ask questions, again, like I did with Paul, my very first patient. What is love? What is music? That kind of, and get very interesting answers. So as soon as you recognize that there's more to this world than your conscious self, you're in spiritual territory. If there's a higher power, I mean, the subconscious, in a sense, is a higher power than the conscious self. It knows more, is wiser. So just awareness of subconscious, I think, gives you a spiritual sense. And if you believe the subconscious extends beyond you, then of course that's an even greater sense. So when you ask what's the need of a higher power, I think that we humans need perspective to do well. If all we see is what's in front of our eyes, and depending on your state in the world, you could say, well, this life is not worth living. Or you can say, oh, it's about earning money and being rich and living in a fancy home. But ultimately, that all goes away, and it's kind of meaningless in its own way. If, on the other hand, you believe in a higher power, this is, for me, just how it works for me, then you can say, well, I'm here to learn lessons. If it's really hard in my life, I'm learning, I'm helping others as best I can. If you're very rich, or I can help others, I need to do good with my money. So I think that's what gives people perspective. All that being said, for each of us, it's our own journey. So I can tell you this, and it might resonate with you or some of your listeners, but for many, it won't resonate because they haven't had the experience. So all I can say is keep an open mind. I use some of the techniques in my book, The Life Guide for Teens, about listening to your inner self, developing your spirituality, and see what happens. I think that if you keep an open mind, you will see. I talked before about being guided. I strongly believe that I've seen many times my life course has changed by people I've met. And I think if you live long enough and you look back at your life, you'll see that. Sometimes it's not so obvious when it happens. For me, at this point, when it's happening, I can sort of tell already because I've seen this before. And it's wonderful to realize that happens. But each of us has to develop our own experience of that. And you have to have an open mind. So if I can tell a quick story, I have one patient, I'm going to talk about it in my next book, who saw Hebrew in his imagination. And he's not a Hebrew speaker. He's never studied it, but he could point to the letters that he was seeing on a Google letter chart. And I knew what he was saying because I'm a native Hebrew speaker.
Right.
And he did this on 3 different occasions. And I was amazed. And I don't think that came from I know it didn't come from his conscious mind. He doesn't know this. And it came from his subconscious mind. But where did the subconscious mind get it from? You know, he thought he was a reincarnation of a rabbi. I suppose that's possible. Or maybe there's a repository out there that people can access. There's different theories. So I told this story to a friend of mine from synagogue, and I said, to me, this proves there's something out there beyond this life. It's obviously there's something else going on. And you can call it God if you like. And my friend said, nope, he doesn't believe it. He told me about his Mexican maid who barely spoke English, who saw these writings in her dreams. She wrote it out and showed it to him, and it looked like Hebrew to him. He took it to the rabbi, and the rabbi said, oh, these are Hebrew prayers. This is from the prayer book. And he showed them, he showed them, my friend, the prayers from the book. And my friend said, well, how does she know this? And the rabbi said, I don't know. And I said to my friend, well, doesn't that prove to you there's something out there? How did this Mexican lady come up with these things in her dream? She said, I don't know, but I don't believe it. So if you don't want to believe, you don't have to. But most people, if they had such experiences, will start realizing there's stuff out there that we don't see in day-to-day life.
Indeed. And just the who am I question, just asking your subconscious, whether it's, you're sitting in traffic somewhere and there's nothing better to do, or there's a lot of power in talking to your subconscious right before sleep. So can you talk a little bit about that for I have a prayer routine right before sleep, but for someone who's not religious, don't claim to be spiritual in that way, how is talking to your subconscious right before sleep very powerful?
Well, your subconscious is active while you're asleep. You know it's active. It shows you dreams as an example. Mm-hmm. And in fact, dreams and subconscious work actually work as therapy. They did a study where they showed people with PTSD a movie that sort of triggered them. And then they studied them for the next month. And during sleep, they would wake them up and say, what were you dreaming about? And half the people would dream about their trauma and half didn't. And a year later, they went back to the same people, and the ones who dreamed about the trauma no longer had PTSD. The ones who hadn't dreamed about it still had PTSD. So that's an example of how in dreams we work things out. And dream work is subconscious work. So before you go to sleep, you can sort of give your subconscious an assignment, sort of like you gave your comfort people assignments. You say, I'd like to solve this issue or give me guidance about this. There's an old Guatemalan tradition, Guatemalan worry dolls. Are you familiar with them?
Yes.
So you take a worry doll and give her your worry and put it under your pillow, and the next morning she'll give you an answer. That's subconscious work. That's another way of getting stuff out of the subconscious.
Mhm. That, that in itself is profound. I tend not to dream or remember my dreams anyway.
Right.
But sometimes I do. And I always get super concerned about it because it's like, what does this mean? What does this dream mean? But if I'm hearing what you're saying, then if I say, what does this dream mean? My subconscious should provide me an answer.
And can provide you an answer. And the meaning could be as simple as I'm working through this issue for you to is something you should watch out for. Um, I have this, I work with kids who have OCD, obsessive compulsive disorder, and a treatment for that is called exposure response prevention. So let's say you are afraid of germs. And so, and then like when your hands get dirty, you wash them for 20 minutes to make sure the germs are gone, or you avoid germy places. So the treatment exposure response prevention involves exposing you, like making you get your hands bloody, but not allow you to wash them, or have somebody sneeze on you and not allow you to wipe your face. That would be an extreme exposure. And then you don't respond, and after a while you get desensitized. You stop responding. So, but many people don't like that because it's kind of scary and gross. So I developed something called internal exposure response prevention, where I tell the subconscious, expose the person in their minds to whatever is scaring them and in increasing intensity. So, for example, if they're exposed to germs, they might imagine being in the room and the three doors down and somebody's very sick. Or now there's somebody next door who's sick. Or there's somebody in the same room who's sick. Or somebody just threw up in front of you, getting it more and more intense. And I tell the subconscious, please expose the patient to those thoughts. And oftentimes they do it in a dream. So they'll say, oh, I dreamed about this. And as the kids do this, their OCD goes away. Example of
Incredible.
subconscious therapy.
That is just incredible.
Right.
Wow. Yeah, I love that. You're just such a wealth. You're just such a wealth of knowledge. How do you deal with difficult people? How do you teach kids how to deal with difficult people? Bullying is an issue, and anxiety since the pandemic, Dr. Anbar, is through the roof. You've probably seen it in your clinic as well. Anxiety in just small kids, medium-sized kids, big kids, adults. It's everywhere. So how do you get people to deal with anxiety, especially anxiety when they might encounter a bully at school, or the teacher they don't like, or the boss, or the coworker that drives them crazy, or in general?
So you have to remember the people who are not treating you nicely have their own issues. So first, give them the benefit of the doubt. Maybe if you think your teacher is mean, or you think that the bully is being mean, remember they're having their own issues. So don't personalize it. It's not about you, it's about them. That's first thing to keep in mind. Then I preach kindness. Be kind. Most people respond to kindness. I tell a story in the book about the dragon lady. She was in charge of when I had to hire a person, she'd have to sign off on it. And she would wait, she would be very lax in her duties and wouldn't sign the forms in a rapid fashion. And at one point, I'd waited a couple of months, and whenever I went to the department secretary to ask what's going on. She said, well, she hasn't signed the form yet, the dragon lady. And I said, well, can you ask her to sign a form? She says, oh, no. When we ask the dragon lady to sign a form, she puts it on the bottom of the pile. So I decided to take the matters into my own hand. And I went to the hospital gift shop, bought a box of chocolate, came to her, and I said, I have a gift for you. I wanted to thank you for all the hard work that you do for our department. She said, a gift for me? Nobody ever gives me gifts. And she took it, she ate it. She said, wow, is there anything you need me to sign? And I said, yeah, this form. Here you go. I never even asked her for the form. She offered because people respond to kindness. And I guess the third tip I would say is use loving kindness thoughts. So kids sometimes stare at me when I suggest this because something they don't like, but I say, wish them well. This is out of Buddhism. May you be happy. May you be healthy. May you be full of joy. May you be calm. Just focus on the person you don't like with those loving kindness thoughts. And more often than not, that changes their dynamic. How? Well, when you think loving kindness thoughts, I think your own beliefs about that person start to change, and maybe non-verbally things change. But I also believe that thoughts affect other people. I guess that's a little bit more spiritual, less scientific, but I do believe that. And I've seen time and time again the dynamic between a mean teacher and a student, between friends change. Doesn't always work, but those are 3 tips. So give the benefit of the doubt, be kind, and use loving kindness thoughts.
And how about if I'm too anxious to?
Well, then you need to work on yourself. So we talked about using a calming sign. You can do rehearsals in your mind. You can imagine talking to that person in your mind. So desensitize yourself. It's the same principles, just in different forms. Talk to your inner self. Your subconscious typically is not anxious. Subconscious will tell you, you can do this, you can do this. So there are many tools to help with the anxiety. And the pills, they don't help make the bully go away, the mean teacher go away. So I think I'd much rather you use your own mind than depend on medications that work incompletely.
I know. And of course, we both know that there's a time and place for the pills. I know that as well. But in the meantime, you develop this, because really
Right.
it's about empowering yourself
Right.
to be able to work through whatever issue it is, so that the next time the lesson comes along, you already know the material so that you can pass this lesson, right? You can pass this test. So,
I
Dr.
think the time for medications would be if you're too anxious to even start helping yourself. Then I would low-level anti-anxiety medications seem to help.
And your little explanation about the dragon lady, when you gave the dragon lady a chocolate, in her own mind, it wasn't about Dr. Anbar that's so nice. It must be, wow, I must be not that mean. I must be okay if Dr. Anbar shared a chocolate with me.
Exactly.
So,
Exactly right.
yeah, so you created that ripple effect, which extends way beyond that interaction that you and she had at that moment. It might have created an effect in her that would actually change who she believed herself to be.
Correct.
So this show is all about hope, and your book is full of hope. It's full of empowerment and how to get through the tough times. If teenage years are anything, they're tough. Emotions skyrocket from one end to the other. Nobody seems to understand you. Life is hard. What's your last message of hope, Dr. Anbar?
My last message of hope, be compassionate.
Oh, yeah.
Be compassionate to yourself and others.
So thank you for that. Thank you for your wisdom. Thank you for your hope. And thank you for your time today. And to know that I'm #1, your first stop on your new book tour, is just such a privilege. So I honor that. And I am totally going to use that information.
Excellent.
Thank you to everyone for watching today. It's a privilege to have you here. And if you liked, please subscribe. By subscribing, that helps and goes a long way. So Dr. Anbar, you take care, and I hope to see you in, well, closer than 4 years. You're going to get that book done sooner than 4 years. And
Thank
then
you.
oh, you're welcome. And by then you'll have worked with 10,000 children,
There you go.
I'm sure. Bye-bye.
Bye-bye.
This podcast and Inspired Healing Hypnotherapy do not provide medical advice. The information included here is not limited to text, graphics, images, or other material contained, and are for informational purposes only. No material in this podcast is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen, and never disregard professional medical advice or delay in seeking it because of something you have heard on this site.